Today, more than ever, nursing skills at the baccalaureate level are in high demand. The National Academy of Medicine has called for at least 80% of nurses to have a Bachelor of Science in Nursing degree or higher by the year 2020. Why is having a BSN so important? With the influx of more complex chronic diseases and an aging and more diverse population, the knowledge and skills necessary for nurses to do their jobs are expanding.
First of all, I expect them to be clinically knowledgeable and skilled in their area of specialty. Other skills that I expect nurses to have is the ability to base their practice on evidence. I expect excellent communication skills, and I expect nurses to speak up, especially around safety or in advocacy of their patients. I expect nurses to be good team players and collaborate with their physician colleagues and other disciplines.
There is a growing body of evidence that shows that BSN graduates bring unique skills to their work as nursing clinicians and play an important role in the delivery of safe patient care.
A higher percentage of BSN nurses results in lower length of stays for patients, less readmissions, less mortality. So it has a direct effect on patient outcomes.
Because of this growing evidence and changing needs of patients, employers in Washington and around the country are increasingly requiring nurses to have a BSN degree, or they expect them to earn it within a short time period. Nursing students can start in a BSN program at a university, earn a Bachelor of Science in Nursing degree, and take the NCLEX RN exam. Alternatively, registered nurses who have earned their associate's degree in nursing at a community or technical college can go on to an RN-BSN program at a university for a Bachelor of Science in Nursing degree. These programs are typically designed for nurses who want to keep working while they go to school.
What's really exciting to me about the RN-BSN program is they've already got those pre-licensure skills under their belt. And so when they come to us, we can focus on evidence-based practice. We can talk about some of the ethical issues that we see every day in the healthcare arena, whether it's in a hospital or in the community.
For example, like if you're living in Weiss Center, you have access to different type of healthcare.
We can talk about interdisciplinary practice. We can talk about challenges in communication between nurses and other disciplines, between nurses and administration. The goal is that it doesn't duplicate what they already have, but really adds value and extends their education to a higher professional level.
The programs may vary across different institutions, but there are certain key elements that every BSN curriculum will have. A bridge course, coursework on leadership and systems thinking, evidence-based practice, population-based health and social justice to address health disparities.
I think for me, the big change was how I thought about things, and I think that's hard to do. And I think that's one of the good things about the bachelor program is it changes the way you think, and if it's changing the way you think, it's going to change your culture.
The bachelor's program really sort of broadens your lens in terms of your critical thinking skills and your writing skills, communication skills, and then it gives you sort of a broader spectrum of evidence-based research and for nursing, and it broadens your nursing perspective.
I was able to tailor my education to my own practice. The great thing is our instructors and professors gave us latitude so we could choose certain topics and then run with it. There are several modifiable risk factors that we can do each night, and that was something that from the research, I was able to implement directly to my practice.
The care that's provided in the hospital is the smallest amount of health care provided. Most of the care delivered is in the ambulatory setting, and so nurses have to be to assist patients and really facilitate the transitions to other settings so that there aren't any gaps and that patients don't fall through the cracks.
As their work takes them into the community setting, BSN students see firsthand the barriers many patients face in managing their illnesses, which ultimately lead to hospital readmissions. Students learn to navigate across the full continuum of care, learning how to educate patients and home caregivers about follow-up care and link patients with primary care providers and community resources that address social determinants of health, prepares nurses to help their facilities meet the triple aim: improving the patient experience of care, improve the health of populations, and reduce the cost of health care.
When I was in the ADN program, it was, I just need to learn skills, and I didn't really understand how the hospital system worked. And recognizing my role as a nurse, it's an important role for preventing a readmission or making sure patients have the necessary tools and resources once they leave the hospital.
It was the most exciting and fabulous decision to go from an ADN to a BSN. It allowed me to expand my clinical knowledge from the clinical setting to the community setting, which is where I really wanted to practice with communities, more specifically with underserved communities and Latino communities as well. The advantages of a BSN, and I think, are definitely the ability to advocate for the patient at a level that is competitive with the professionals you work with in the setting, with the pharmacists, with the physicians, with the sociologists, and you have a team working with patients. So that's a huge advantage for anybody who's interested in advancing the nursing profession and advancing the voice of nursing at the decision tables.
I've been a nurse for about 5 years and I needed some inspiration. So I needed to revive my career and just feel inspired. And I know that with a bachelor's, it's sort of a launch pad to becoming, you can go in different areas of the nursing arena.
I get lots of questions from nurses who wonder about when's the best time to go back to school. And what my classic response is, there's never the perfect time. So you have to go now, because it will never be any easier at any other time. And then what I also point out is that most of the RN to BSN programs now are really geared towards the adult learner, the seasoned nurse who's been out of school for many years. So they really support and have resources available to make that transition into being a student again.
The faculty and staff were very supportive. They knew we were adult learners. We were working and going to school, and we had our own lives. And so that was factored into our education.
The other thing I always point out to nurses is you're never too old. And it doesn't matter how old you are or how near you are to the end of your career. All this does is really improves how you manage patient care.
If you're employed, talk to your employer about going back to school. Ask about what resources are available to you. Some employers may offer tuition reimbursement, flexible scheduling, or other supports. If you belong to a professional nursing organization or labor union, find out about scholarships or other support that is available.
Being a single mom, there's no way I would be able to go back to school with all of the financial, responsibility that I have. The hospital that I work with and the union provided financial resources to help me get my bachelor's in nursing. And not just financial resources, they also provided resources like tutoring in math, English or writing, and computers, because I'm one of those people who is not computer savvy. So with all of those, I was able to graduate within that 2-year program, and they really helped me a lot.
The Washington Center for Nursing website has a list of all approved nursing programs in Washington State. If you're an associate degree nurse, the interactive toolkit for finding RN-BSN programs will help you take the first step toward narrowing down a program that fits your lifestyle. Before applying to a nursing program, there are things you will want to know. So make sure you talk to a representative of the program to know what is expected and what will be expected of you.
Advice I'd give to people considering a BSN program who still want to be a good student and participate at work and families would be to know your priorities. I've had during a little bit before my bachelor's program, I kind of had a motto run through my head is that I'm just as busy as everybody else. And really, what I'm saying, when I say that I'm too busy for something, I'm saying that that's not a priority, and that's okay to have certain priorities. So going into the bachelor's program, understand what my priorities were: family, school, and work.
My advice with, as far as, I find a good support system. Family, workplace. I mean, everybody has to be on board for you to succeed.
In addition to better outcomes in patient care, a BSN prepares a nurse for career advancement, including graduate education, which is a step to key leadership positions, or nursing education and research.
Through the education in a BSN program, you begin to look at research and you begin to look at cause and effect. And in graduate school, you have more ability to actually put into practice some of the research that you consume during your BSN years. And of course, during the DMP and PhD you create research that actually will hopefully affect people before they are sick, so we can prevent people from getting diabetes. And that feeling of prevention, of actually promoting health, is a feeling of empowerment and accomplishment. And most of us who go into nursing wanting to make that critical difference.